Hi there, my name is Mark Mullet, and I'm the Senator from Issaquah representing the 5th District. And I wanted to give everyone an update on the first third of our session, which officially ended last Friday. And that was the date that all the bills had to get out of the committee on the Senate side if they were going to move through the process. And we had a few bills that were important bills that didn't make it out of this first hurdle of the legislative process. And the first one was a healthcare transparency bill, and it's modeled after a program in King County called Healthy Incentives, where all the county employees had to get on wellness plans or else they'd have to pay more money out of pocket towards their healthcare. And this bill suggests that all the state employees follow that same example, which is you get on a wellness plan. If you do, then you don't have to pay any more money out of your current proportion out of your paychecks. But if you're not willing to get on a wellness plan, then you'd have to contribute more money out of your paycheck towards your healthcare expenses. And another bill that did make it out of the committee was, we call it the donut hole bill. And this is very important to everyone who lives in Maple Valley. And in the middle of Maple Valley, there's a 155-acre parcel that's owned by King County, and King County controls the zoning regulations of that parcel. So this bill would enable this 155 acres to be annexed into the city of Maple Valley. So King County will still own it, but then Maple Valley will have control over the zoning, so it makes it easier from city planning purposes for long-range planning goals for that city to plan accordingly. And the final bill was my first bill, which was the EpiPen bill. And this bill enables schools to request a prescription for an EpiPen at the school level. So that way, when there's a child at the school who hasn't been pre-diagnosed as being allergic to peanuts or bee stings, etc., that the school could have an EpiPen on hand that they would be able to give this child if he starts to go into shock. So they don't have to wait that extra 4 or 5 minutes for the emergency services to arrive. And the couple bills that we had that did not clear this first hurdle last Friday, which means instead of being 2-month projects, they become 12-month projects, one was around healthcare transparency, and that was a bill to require that all doctors and hospitals would have to put pricing on their website to let consumers know in advance how much things cost. And the second bill that we're going to work on is around a simple majority vote for school construction bonds. Right now, we're one of the few states in the country that requires a 60% majority to pass a local school bond to build additional capacity in your school district. And this bill would lower that to a simple majority at 50%. And those are both bills that we will continue to work on. Because I'm brand new, we only had a couple months before the session started to work on these bills, but the advantage we have now is from the time this session ends in April, we'll have the whole rest of the year to work with stakeholders to make sure these bills have a better chance of getting through the process in 2014. So thank you very much, and please call our office if you have any questions. Thanks.